Mrs. Boyeon Kim, Head of Clinical Research of Korea Tooth Bank. Today, I will present a case study about socket preservation using Moldable AutoBT, a moldable Autotooth bone graft material. And we will also take a look at long-term follow-up for 6 years after socket preservation. The patient had a vertical fracture on the maxillary right second premolar due to the trauma and lead to tooth extraction. First, we're going to watch how to mix Moldable AutoBT. Put saline in the Moldable AutoBT dentin powder and mix it well using instruments. Just like mixing alginate, mix and repeat it along the wall of the container about 20 seconds until it becomes viscous. It can be shaped as the desired form for the grafted area once it is viscous enough. It can be made into spherical, cylindrical, conical shapes. It is convenient to apply to the defects because it retains its shape enough to be picked up with tweezers and moved into the implanted site. The picture on the upper left shows the implant placement into extraction socket. This is well mixed shape on periosteal elevator shown in the previous video, which was ready-made with the patient's tooth 2A to Moldable AutoBT dentin powder graft material for the patient. After molding Moldable AutoBT to be fit into defect, move it to the extracted site for socket preservation. Press lightly with either instrument or finger to fit in. At this moment, you may push and transfer it naturally to be fitted into the socket rather than forcing it excessively. And finally, be sure to check that the dentin powder gets wet with the patient's blood. When the dentin powder is mainly composed of type 1 collagen mixed with blood, it forms collagen sponges holding excellent sustainability, so you do not need membrane to suture. If you look at the healing process, in 1 to 3 weeks after suture, it shows the excellent biocompatibility of dentin material. In other words, there is no minor inflammation. This will be the role of type 1 collagen in dentin, which is exactly same as that in the alveolar bone. Left picture shows demarcated line of periodontal ligament in the socket, and Moldable AutoBT is grafted around and next to the implant. After 2 months, the demarcation line is fading. This is resorption. The inner powder boundary structures began to disappear. In this way, the resorption process of the powder leads to new bone formation. After 5 months, the demarcation line disappears and powder has been replaced with a new bone, and the area is remodeled with a completely new cortical bone. 5 months later, let's look at the second surgery. In this moment, the implant area is not hardened, as you see. In this part, many doctors consider it as failure of surgery, and they may question why it did not form as hard bones. The correct answer and the conclusion are dentin is a collagen material, so it never hardens in 5 to 6 months' time. In other words, it takes about a year for this dentin material to complete mineralization along with the formation of new bones. So the picture above shows the mid-stage of the bone formation. Comparison of dentin material to hydroxyapatite. The existing hydroxyapatite product is basically hard material, so hydroxyapatite normally shows hard bone in the second surgery within 3 to 6 months duration. In other words, the mechanism of dentin-based new bone structure formation is completely different from that of hydroxyapatite. The picture on the left is 5 months after first surgery. New buccal cortical bone is already forming, and after 5 months of provisional loading, the buccal cortical bone gradually thickens and a lot of cancellous bone is formed inside. The figure on the right is 6 years later. Final prosthesis has placed, and this is the topic of the day. The buccal cortical bone surrounding the neck of the implant is formed to have a normal thickness, and the cancellous bone is also vigorously developed to adapt to the occlusal force with the final prosthesis. Therefore, marginal bone resorption is rarely seen. We call the result as the Sound-cortico-cancellous bone complex was formed. In my case, observation about 12 months after the first surgery and prosthesis completion, if a Sound-cortico-cancellous bone is formed around the neck of the implant, the surgery procedure is judged as a success. Today, I have introduced the long-term follow-up case for a simple socket preservation procedure using Moldable AutoBT for 6 years. For the results of many cases, please refer to the literature of Korea Tooth Bank published as a case series studies and retrospective studies below. So the messages for today is, first, from the technical point of view, Moldable AutoBT can be operated very simply, and it can help with suture and bone formation without membrane. Second, as biological aspect, it takes about 2 months for the biologically grafted dentin powder to be completely absorbed. Since it has not been mineralized even after about 6 months, it still has the characteristics of type 1 collagen. As a result of long-term observation, it can be concluded that Sound-cortico-cancellous bone are formed well in the neck area of the implant and well protected against perio. Thank you for your kind attention. This has been Boyeon Kim from Korea Tooth Bank.